checking for decapitalis IC, for deformities, contusions, abrasions, lacerations, punctures or penetrations, burns or bruising, swelling or tenderness, instability, and separate. I'm going to check the ear for cerebral spinal fluid. I'm going to check the nose for cerebral spinal fluid. I'm going to check for any battle signs behind the ears. I'm going to check for raccoon eyes, for any airway obstructions or broken teeth or coffee ground nemesis. I'm going to check for soot or any syringe nasal hair or facial hair. I'm going to go to the neck. I'm checking for decapitalis IC. I'm checking for subcutaneous emphysema. Checking for tracheal distension or jugular vein distension. I'm checking her carotid pulse on both sides. And I'm going to check for a medical alert tag. I'm going to check her chest for decapitalis IC. I'm checking for paradoxal movement. I'm going to check for any excessive movement in her chest. I'm checking for subcutaneous emphysema or suction chest wound. I'm going to go down to her stomach. I'm going to check for decapitalis IC. Check for any rigid or guarding or distension or pulmonary masses. I'm going to go down to her hips. I'm going to check for decapitalis IC. I'm going to push in and then down. I'm going to go to her legs. I'm going to check for decapitalis IC. I'm going to check for any tattoos or track marks. I'm going to check her pedal pulse. I'm going to go to her other leg and check for decapitalis IC and her pedal pulse. Any track marks or tattoos. I'm going to check for any medical alert tags. And then, can you push against my foot? And then pull. What toe am I touching?
The pinky toe.
Alright, and push and pull. And what toe am I touching?
The big toe.
Alright. I'm going to go to her arm. I'm going to check for decapitalis IC. I'm checking for any track marks or tattoos and her medical alert tag. I'm going to check for a radial pulse and a brachial pulse. Can you squeeze my finger? And what finger am I touching?
Thumb.
I'm going to check her other arm for decapitalis IC. I'm checking for a medical alert tag or any tattoos or track marks. Can you squeeze my fingers? What finger am I touching?
Pinky.
Alright. I'm going to roll her on her back to me. I'm going to check her spine for any subcutaneous emphysema or for any tattoos or track marks. And I'm going to check for edema, and that would include my trauma assessment.